Thank you for joining. My name is Kailey, and today I'm going to be giving a presentation on high blood pressure as part of the Script Your Future webinar series. Script Your Future is a student-led campaign to improve patient health outcomes by increasing medication adherence in our community. So today I'm going to be presenting on heart health and high blood pressure, which is a disease that affects many people in the United States and globally. So to start, I want to give a little bit of information about myself. I am from Ohio and I attend Northeast Ohio Medical University. At NEOMED, I am a part of the Rural Medicine Education Pathway. This pathway helps me learn a lot about rural medicine as well as family practice. This past summer, I did research on medication prescribing in older adults who were admitted for traumatic falls. And we looked at a lot of different medications that patients were on, including blood pressure reducing agents. So I'm excited for the opportunity to talk about this prevalent disease. So high blood pressure is a complex topic, but I want to spend our time together breaking down the key pieces of information. First, I want to give some background information on what high blood pressure is and some of its many causes. And next, I want to talk about the importance of managing high blood pressure. Lastly, I want to talk about the treatment and management of high blood pressure. Hypertension is the medical term for high blood pressure. And your blood pressure is a measure of the pressure or force that your heart has to use to pump blood into your arteries. High blood pressure occurs in many different circumstances, but a common example is when your arteries are hardened and less elastic, and thus it requires a lot more work for your heart to pump blood into them. Vessels are what carries your blood throughout your entire body to all of your organs, and your organs keep your body alive and functioning well. So constricted or hardened arteries, which can cause high blood pressure, may occur in the setting of like atherosclerosis, which people may have heard of. That's when you have a plaque that's hardened along the wall of your artery. And so while there are many different causes of hardened vessels, they can result in high blood pressure. I want to talk a little bit about some data from the CDC on high blood pressure in the US. So I was very struck when I read that 47% of adults have high blood pressure in the US, and this is 116 million people. It's estimated that 75% of these individuals don't have their blood pressure under control. There are a lot of reasons why people may not have blood pressure control. For example, they may have not been prescribed medication, or they may not have started taking a prescription medication. And 34 million people fall into these categories or reasons for why their blood pressure is not controlled. Hypertension actually increases the risk for a heart attack or a stroke. And these are the leading causes of death in the US. It's estimated that more than 500,000 deaths were associated with hypertension as one of the contributing causes. The 500,000 deaths that were associated with hypertension as a contributing cause occurred due to a stroke or heart attack. However, about 35,000 or 1% of deaths in 2017 occurred in the setting of just having hypertension. So hypertension is particularly prevalent in the eastern states of the US, and the state of Ohio has a rate of more than 30%. And now I'm going to talk a little bit about your heart and how it works as a pump to deliver your blood to all of the organs of the body. So your heart pumps blood into arteries, and arteries are vessels that carry blood, oxygen, and nutrients to your organs, such as your brain, your stomach, your bones, your skin, and essentially everywhere throughout your body. Once oxygen and nutrients have been delivered, the deoxygenated blood goes back to your heart, and the heart pumps it into the lungs to obtain oxygen while you're breathing. Your lungs then return the blood to the heart, and the process starts over again. And this graphic here kind of talks about why the arteries and the heart are all connected and why it's important to maintain a healthy blood pressure so that you don't put additional stress on your heart. So at some point, you've all had your blood pressure taken. And I have a little diagram here to talk about how blood pressure is taken. And the blue is supposed to be a blood pressure cuff, and the red is blood flowing through your arm. So initially, the individual taking your pressure is going to put the cuff on your arm and inflate it to a high enough pressure that it's going to temporarily pause your blood flow. At this point, while they're listening with their stethoscope, they won't be able to hear a pulse. They're going to slowly release the pressure in the cuff, and they're going to listen for the start up of your pulse again. And they're going to record this number. This is called the systolic pressure. As the person continues listening, eventually your pulse sound will disappear, although your blood is still flowing. And they're going to record this number, and this is called the diastolic pressure. And now I'm going to talk a little bit about what those numbers mean. The systolic, or the higher number, is the pressure in your arteries when your heart is actively beating. An example of this pressure may be 110 millimeters of mercury. The diastolic pressure is the pressure in your arteries between heartbeats when your heart is at rest. And this is the lower number. And now I'm going to talk about how blood pressure can be classified. These classifications are from the American Heart Association, and they're generally accepted by all of the US standards. So a normal blood pressure is a pressure that is below 120/80. Either the top or the bottom number can be elevated in order to have a diagnosis of high blood pressure, but anything above 130/80 is considered high blood pressure. There are different stages of high blood pressure, and I put those numbers in this chart for your reference, just in case you wanted to look at those. Additionally, I want to talk a little bit about something called a hypertensive crisis. This is something that happens when your blood pressure is above 180/120. When the pressure is this high, it can cause some of your organs to become damaged rapidly. So if you ever have a blood pressure that you take on your own and it's this high, you would want to consult your doctor or obtain medical care immediately to prevent any kind of organ damage. Additionally, if you have high blood pressure and you have any symptoms of this, you would want to seek care. So some symptoms of a hypertensive crisis are headache, back pain, chest pain, shortness of breath, weakness, numbness, or vision changes. And the United States Preventative Services Task Force recommends that all adults over the age of 18 should be screened every 3 to 5 years, and any adult that is 40 or older should have their blood pressure taken annually. And a blood pressure screening is the initial reading of your blood pressure that you get at the office. Generally, this is the pressure that the nurse takes when you go into the office before the doctor comes in. If this blood pressure is elevated, then the physician is going to want to confirm that you have high blood pressure, and it's ideal to take a confirming blood pressure measurement outside of a clinical setting that's in a more natural environment for you and will reflect what your pressures would generally be throughout the course of the day. One way that you might confirm your blood pressure is taking your blood pressure at home with an automated blood pressure monitoring device. Additionally, you can go to your local pharmacy or even like Walmart. They will have the machines that you can use to take your own blood pressure. So there's a lot of things that can affect your blood pressure reading. These are things that you can do prior to having your blood pressure taken. They're not actual causes of high blood pressure, but they can affect the reading that is taken at the office. And I wanted to talk a little bit about those. So the American Heart Association recommends that patients are seated for at least 5 minutes before having their blood pressure taken, because standing can actually decrease your blood pressure, but the most accurate reading is taken when you're sitting. Additionally, stress can cause high blood pressure. Chronic stress can cause an individual to have hypertension, but some individuals experience temporary stress from being at the doctor's office. This is known as white coat hypertension, and this can occur when you're at the doctor's office, and it can increase your blood pressure. That's one reason why it's important to take a blood pressure again outside of a clinical setting if the physician thinks you may have hypertension. You shouldn't use caffeine or nicotine or exercise within 30 minutes of having your blood pressure taken, because these can increase the reading. Additionally, a full bladder can increase the blood pressure reading. And finally, when your blood pressure is taken, it's most accurate if you're seated with your legs uncrossed and your feet flat. You should also have if you can, remove your sleeve and have your skin on your arm bare for the pressure cuff, because this can help the person taking the blood pressure get the most accurate reading. So those are just a few things I wanted to share with you whenever you go to have your blood pressure taken for the next time. And now I'm going to talk about some things that are risk factors for developing hypertension. Some risk factors are modifiable and others are not. Things that can be changed are cigarette smoking and exposure to secondhand smoke, diabetes, overweight or obesity, and high cholesterol. Managing diabetes and high cholesterol either through lifestyle management or through medications can help decrease your risk for developing high blood pressure, as well as losing weight. Consuming an unhealthy diet that's high in salt, alcohol, or low in potassium can be a risk factor for high blood pressure, as well as being physically inactive. Some risk factors that are not as modifiable would be having a family history of high blood pressure or certain genetic causes. Race and ethnicity, and Hispanic and the Black race are associated as a risk factor for high blood pressure. However, a lot of studies now talk about social determinants of health and how these can impact your risk for high blood pressure. And social determinants of health are things such as access to healthcare, education, and access to healthy foods. So most studies now are showing that these are more important as a risk factor for high blood pressure than a race or an ethnicity is. Older age and the male gender are associated with high blood pressure, chronic kidney disease, and obstructive sleep apnea. So why is it important to manage hypertension? Well, I talked a lot on the slide with the statistics from the CDC about stroke and heart disease, and those are examples of cardiovascular disease. Blood pressure is actually known to be a predictor for developing cardiovascular disease. Cardiovascular disease is a disease of either the heart or the arteries. And a few examples of this are a stroke, brain bleeds or hemorrhages, stable angina, which is chest pain that's experienced when you're exerting yourself physically, such as by exercising or by going upstairs, peripheral artery disease, a heart attack, a transient ischemic attack, which is stroke-like symptoms that don't result in permanent damage to the brain, and an abdominal aortic aneurysm. Those are some examples of cardiovascular diseases that high blood pressure is known to be a risk factor for. And the study had some different charts, and in red, there's the number of individuals who have high blood pressure that developed the disease, and the blue line represents the number of individuals who had a normal blood pressure that had this cardiovascular disease. So for all 12 diseases that they looked at, high blood pressure was associated with a greater number of people. So there are a lot of benefits to managing hypertension. For example, it can help you live longer by decreasing your risk of having a fatal heart attack or a stroke. Additionally, it can reduce healthcare costs. The CDC reported that high blood pressure can result in up to $2,500 of healthcare costs extra in people who have high blood pressure compared to individuals who don't. I thought that was pretty striking, because by managing high blood pressure, you could potentially decrease the amount that you pay by $2,500 per year. The costs are accrued because of medications, office visits, hospitalizations, or other diseases that can occur as a complication of having high blood pressure, such as heart disease. So by having a normal blood pressure, or at least trying to manage high blood pressure, you can reduce some of these costs. Another study showed that blood pressure management in all US adults who it's currently unmanaged in can prevent 91,900 heart attacks, 139,000 strokes, and 115,000 cardiovascular deaths over the next 5 years in US adults. That was a pretty striking number to me that I wanted to share. And one other interesting number that the CDC reported is that if our population reduced their sodium intake to the recommended value each day, which is under 2,300 milligrams. It could reduce high blood pressure in 11 million adults and save $18 billion in healthcare costs. Additionally, managing high blood pressure can increase quality of life by reducing the risk for developing some of the diseases shared on the previous slide. And thus, as the Scripture Future campaign points out, taking medications as prescribed or following a healthy lifestyle regimen is important for having a long and healthy life. Now I'm going to talk a little bit about the treatment and management for high blood pressure. So the recommended blood pressure is under 120/80. And for anyone who has high blood pressure, the physician and patient should discuss what the patient's goals are for managing it. For example, one individual might prefer lifestyle management, but another individual may prefer to take a medication to treat their high blood pressure. I also want to talk a little bit about low blood pressure because this can also have some symptoms, and it also isn't recommended to have blood pressure under 90/60 if it's symptomatic. Some symptoms of low blood pressure are dizziness, fainting, an inability to concentrate, nausea, confusion, or blurry vision. But the Mayo Clinic recommends that only symptomatic low blood pressure is treated. Some individuals have a low blood pressure, particularly athletes. Even I remember when I was younger, I was a cross-country runner, and so whenever I had my physical, my blood pressure would sometimes be lower, and it was associated with just being an athlete. So I didn't have any symptoms, and that's why it's important that only symptomatic low blood pressure is managed. But those are some symptoms to watch out for. Blood pressure can become low if either the medication regimen is too aggressive or if a patient accidentally takes a double dose of a medication. So I just wanted to briefly touch on that. So here are some tips from the American Heart Association for managing blood pressure or reducing the risk for developing hypertension. They recommend that individuals stop smoking or the use of nicotine products, including vape and tobacco, as these can increase your risk for developing hypertension. They also recommend obtaining and maintaining a healthy weight, which is a BMI under 25. But they do point out that even losing 5 or 10 pounds can make a difference in your blood pressure. Additionally, they recommend a diet that's low in saturated and trans fat, high in whole grains, fruits and vegetables, high in low-fat dairy products, and low in sodium. They also mentioned that it's important to have 3,000 to 5,000 milligrams per day of potassium, which a lot of individuals don't meet. All of those nutrients can be found on the backs of your food products on the labels. So if managing high blood pressure through diet is something that you're interested in, a tip is whenever you're at the grocery store to look at the labels on the products and look at the sodium, potassium, and saturated and trans fats to see what the levels are and follow some of these recommendations. The American Heart Association also recommends that women have 1 or fewer drinks per day and men have 2 or fewer alcoholic drinks per day. Exercising at least 150 minutes with a moderate intensity is important. Moderate intensity might be something like a walk or an easy jog. Additionally, you can exercise 75 minutes at a much higher intensity and still meet your exercise requirements. So that might be something as simple as going for a 15-minute run 5 days a week. Lastly, the American Heart Association recommends taking medicine as it's prescribed by your physician. So there are a lot of prescribed medications that have been carefully studied for many years and used safely in patients. If you are on a high blood pressure medication, it's important to talk to your physician if you think you may be experiencing any side effects. Side effects can be due to inappropriate dosing or interactions with other medicines. Side effects can actually occur as an interaction with even over-the-counter or natural medicines. So it's always important to tell your physician all of the medicines that you take, even if it's something that you purchase on your own at your local drugstore or over-the-counter. There are some challenges that are faced with medication adherence and blood pressure control. One of these is on awareness of having high blood pressure, and so no medication is prescribed. And this would occur if you haven't been to the physician in many years or had your blood pressure taken and you don't know that you have hypertension. Additionally, patients who do not have a high enough dose of their medication may not feel that the medicine is working, but going back, talking to your physician and working with them to obtain appropriate dose or being on the appropriate medicine can help treat your high blood pressure. Insurance and medication costs are a barrier for many patients. Some individuals choose not to take medication for different reasons. And barriers to accessing a pharmacy is another thing that can cause issues with medication adherence. As part of the rural medicine pathway, I know that some individuals don't live close to a pharmacy, so that can be one barrier. Additionally, accidentally missing a dose or taking 2 doses at once can be one challenge in controlling your blood pressure appropriately with your medicine. So in summary, treating high blood pressure can reduce the risk of stroke and heart disease and increase your quality of life, help you live longer, and reduce healthcare associated costs. So it's important to talk to your doctor or healthcare provider about your goals if you have high blood pressure, and they can help work with you to develop a treatment plan that includes lifestyle changes, medication, or both. So thank you all for listening. I want to give a huge thanks to the Script Your Future faculty advisors, including Dr. Stephanie Lamer and Kavita and Jasmine for organizing this event, as well as all of the other presenters in the Script Your Future series. And if you're interested in any of the upcoming webinars or medication adherence resources, you can visit the Script Your Future webpage, which I will put in the chat after this presentation. If you have any questions, we can email you back about them. Thank you for listening.